Okay, before entering the room, I will check the medication, making sure it's not expired and that the vials are nice and not dirty as well. Going to check it with the MAR. Okay, making sure it's the right patient as well. This too. Perfect. Check these. Okay, now we would also check it with the provider's orders. Okay. Check this too. Perfect. Now this one. Another nurse would also come in if necessary to come check this out as well. So now I'm going to knock. Say, hi, my name is Alondra. I'm going to be your nurse today. We're going to provide privacy. Can I have your name, age, and date of birth, please? Okay. And I would also scan her bracelet with the medication to make sure I have the right patient. Okay. I'm going to tell her what I'm here to do. So we're here to give you some medication, okay, that you need. Do you have any allergies? No. On a scale from 0 to 10, how would you rate your pain? A 0. Okay, so I'm going to do my dosage count first. So for cyanocovalent, it's 200 micrograms divided by 1,000 micrograms times 1 milliliter, which is equal to 0.2 milliliters. Fluoxetine is 20 milligrams divided by 16 milligrams, which equals 3 capsules. Okay. Insulin, it's 10 milliliters plus 2 milliliters equals 12 milliliters. For tuberculin, we would only give 0.1 milliliters, okay? And then for ceftriaxone, it would be 500 milligrams divided by 350 milligrams, which equals 1.4 milliliters. I'll show you the paper. Okay. So now I can wash my hands, put on my gloves. Another glove on. Okay, now we're going to raise the bed to a sitting position. So first, we're going to be giving fluoxetine, which is for chronic depression. Okay, the side effects can be anxiety and nausea, diarrhea as well. So I will get my pen light out and check her mouth for any lesions, wounds, tears. Okay, and then I would give her a cup of water to see if she can swallow, and she can. So then I would give her medication after checking again with the order, making sure it's the right one. So I would tell her she has the right to refuse the medication, and also the 6 rights, which are right dose, right time, right medication, right patient, right route, right indication, and right documentation. So I would give them to her in her mouth, or I could give them to her in her hand. So here you go. Okay, and now she would take a drink of water. Okay. So now we're going to be doing the insulin, which is to control your blood glucose levels. Can you tell me where you last had your insulin shot? In your thigh? Okay. So we're going to give it this time in the stomach. I'm going to raise up the bed a little bit more. Okay, we would be giving it to her in this area right here, away from the Okay, so now I'm going to get my 2 insulins. So insulin is for to control your blood glucose level, and the side effects can be sweating, hunger, Okay, so now I would get a clean alcohol wipe, clean it, and get a new one, clean the other side. Before that, I would shake it, not shake it, roll it. You do not shake the insulin. Okay, I would clean it again, and then I would get out my insulin syringe. We're going to be giving 10 milliliters of air into the cloudy one without touching the water. Okay, and then I would give 2 milliliters of the clear one air. So now I would grab it. Okay, see? Okay, then I would grab the 10 milliliters, the other one, making it 12. Okay. Okay. Since I already told her the side effects, she already knows that she has the right to refuse the medication, as well as all the 6 rights, which are right dose, right client, right patient, right time, right documentation, right indication, right route. Okay, so I would pinch. Ready? 1, 2, 3. I would also clean it with an alcohol swab before letting me dry. Going slow. Gonna leave it there for a few seconds, then pull it out. We're gonna make sure there's no bleeding. We're gonna cap it again and throw it in the Sharps bin. Okay, putting that to the side, making sure to keep an eye on it, putting gauze on top of it if needed. We're gonna document that we gave both the fluoxetine and the insulin at 8. Okay, now we're gonna be giving the ceftriaxone, the reconstitution one. So this is to treat your UTI infection, okay? And we're gonna be giving it on the vastus lateralis, okay? Some of the side effects of this medication are chest pain and sore throat, okay? So we're gonna crack the vial away from us. So I would get a new one, new vial. Get a new vial and new gloves if necessary. Break it. Okay, away from us. Perfect. Okay, and now we're gonna uncap this one. Cleaning the top with a new alcohol wipe. I'm gonna take out a syringe. And a needle. We would first need the filter needle. Okay. So we're gonna be getting 2.1 milliliters. Would throw this in the Sharps bin. Going to get rid of the air bubble. Okay. camera. Okay, now we would inject it into the powder. Okay. We're going to cap the needle. We're going to take it off, throw it in the sharps container. We're going to put a new needle. We're going to roll it until it's dissolved. Okay. Once it's dissolved, I would again clean the top with a new alcohol wipe and get a new needle. And this time we're going to be getting 1.4 milliliters. So I first, before doing that, I would get 1.4 of air, clean it again as I touched it. Now we're going to insert the air. Now we're going to get the medication. Okay, making sure there are no bubbles. I'm going to show it to the camera. Okay, this we already said was going to be giving in the vastus lateralis. So now we're going to be injecting it. We would clean off the skin with an alcohol wipe, making sure it's dry before I give a shot. So we're going to use the C-track method. We're going to inject it 1, 2, 3. Okay, we're going to push slowly and then take it out, let go. Okay, we would clamp it and then throw it in the sharps container, putting on the gauze if needed. If not, it would go up. It would be alright. We would cover the leg back up, would my initials saying that I gave it at 8 o'clock. Okay, now we're going to be giving the cyanocobalamin, which treats vitamin D deficiency. Okay, it can cause nausea or dizziness. Okay, so now I'm going to clean it. Okay, we're going to grab the needle, syringe, needle. Throw that away. Okay, so for this one, we need 0.2 of air. Okay, so we're going to uncap the needle. We're going to put 0.2 of air in. We're going to get 0.2. Making sure there's no bubbles. Oh. Okay, gonna show it to the camera. Okay, I would clean the skin. We're getting it on the deltoid muscle. So I cleaned it. Now I'm going to wait for the alcohol to dry. And then I would do the C-track method as well. And now we're going to be inserting. Ready? 1, 2, 3. Okay, go slow. Okay, and then take it out, let it go. We're going to put a gauze on it if it's bleeding. Okay, put that on there. Throw that to the sharps container. Okay, now the last one we will be doing is the tuberculin. It's to make sure that you don't have TB. You haven't had any TB in the past month, and it can cause fainting or bruising. Okay, so this we're going to be giving it on the right forearm. So first we're gonna make sure there's no hair, that there's no swelling as well. Okay, there's no bruising, there's no wounds as well. Okay, so first, for that we're gonna give 0.1 milliliters. So I got my vial. I'm gonna clean the top with a new alcohol wipe. Take the cap off. Get 0.1 of air. Inject it in there. Now we're gonna get 0.1 of liquid. Okay, we're gonna make sure there's no bubbles. So now we're gonna show. Okay. I would cap it if necessary, so I could clean the skin, make sure it dries. We're gonna tell her while the skin dries that to not touch where the TB shot is going, and to not be in the sun as much. And it will create a little bubble, and make sure not to put any harsh soaps on it as well. And then it will be checked in 48 to 72 hours after. So now that it's dry, take my syringe, bevel up. Okay, now we're going to be inserting the 15-degree angle. Making a little bevel. Gonna cap it. Throw that away. I would mark where the bevel is, put a circle around it, making sure we know where it is, and then I would document both the cyanocolibin and its 08 initials, then it's the site. Okay, now I would show you my paper, wet. Okay, I documented it. Okay, and now I will tell the patient, is there anything else I could do for you? No? Okay, so now I will make sure you're comfortable position with the bed lowered. Put on the call light. Okay, and then I'm gonna take off my gloves, wash my hands, provide privacy and clean up my area, and then walk out the room.